So, on behalf of the Department of Computer Science and Engineering and our institute, Sri Vishnu Engineering College for Women, Bhimbaram, I welcome all the participants as well as our resource persons to this 1 week national level online faculty development program and societal applications of machine learning. This is our third day. And we have with us Dr. Jafar Ali Ibrahim from VAT University. Good afternoon, sir.
Good afternoon, sir.
I will just try to introduce you to the audience and then you can have your session, sir.
Yeah, sure.
It's a privilege to introduce Dr. Jafar Ali Ibrahim, who has completed BTech in IT from Anna University and MTech from MGR University, Chennai. And he is a full-time research fellow and obtained his doctorate degree from Anna University, Chennai. And his research areas include cloud computing, clinical research, medical informatics, Internet of Things, intelligent system development, machine learning, ontology, big data, and data mining. And he published nearly 42 patents, held 3 international patents, 1 Indian patent granted. And he serves as a reviewer, editorial member, and technical committee member and advisor in many international conferences and journals. And he is a consultant in some IT industries from Malaysia and UK. Dr. Jafar has visited Japan, Hong Kong, Malaysia, Singapore, Indonesia, Thailand, Sri Lanka, Gulf countries for his research activities. At present, he is working as a faculty of Internet of Things department at the School of Computer Science and Engineering under Vellore Institute of Technology, Vellore, Tamil Nadu, India. And it's a privilege to have you here, sir. And you have been with us the second time, it seems to be. Last FDP also have associated with us. And now the floor is yours, sir. You can share your screen and start your presentation. Thank you very much.
Thank you, sir. Thank you. Thank you for your introduction.
Thank you. Please.
Are you able to see my screen?
Yes.
Yeah.
Please.
Very good afternoon to one and all present here. First of all, I thank the management and principal, head of the department of the School of Department of Computer Science and Engineering of Sri Vishnu Engineering College for Women. It is an autonomous institution from the East Godavari district. Thanks for the opportunity given to me as one of the keynote delivering this wonderful national level online faculty development program on societal applications of machine learning from 26th to 30th December 2022. I think this is the third day of session. I take the privilege to deliver some important things and research dimensional views in the area of wearable computing. I think I hope everybody knows about wearable computing. So wearable, what is wearable? So it is a one sub part of Internet of Things. So there is nowadays, day by day, people getting very lazy on their day-to-day activities. So because of that laziness of the human, now everything transformed to in our hand with the help of some artificial intelligence and machine learning techniques. So in this context of artificial intelligence and machine learning transformation, the another milestone is wearables. So even anyhow, wearable is a very old technique, but nowadays it transforming to a new environment, new application scenario. So now let us take what is mean by wearable. So wearable technology, it is a one kind of it's a kind of electronic device designed to be worn on the user's body. Such devices can take many different forms, including jewelry, accessories, medical devices, clothing, or elements of clothing, etc. So the term wearable computing, it implies processing or communication capabilities, but in reality, the sophistication among the wearables can vary. So it's a growing market. Wearable is a very big growing market. Nearly 56.7 million adults are predicted to use a wearable device at least one a month in 2019 onwards, a data has said. An additional of 3.8 million children and teens will have such a device. Over 500 million wearable users were connected to 4G network in 2017. Now that data statistics has been increased progressively, nearly in this 2022, 89 million of people, 89 million of the peoples are connecting over 900 million of the peoples over 89 countries now they are using wearable systems. The market has been very progressively grow with the base of artificial intelligence and machine learning. So what is wearable technology? So the vision behind the concept of wearable computer is the mobile computer should not just be a machine that we put into our pocket when we plan on doing some office work or while on the road we are walking anywhere. So instead of, it will be an integral part of our everyday outfit. Hence, the wearable always operational and equipped to assist us in the dealing with a wide range of situations. Wearable device is defined as a monitoring modality that is owned by a user in daily life. It's usually integrated into items used daily, like watches, eyeglasses, rings, belt, gloves, belt, shirt, shoes, necklace, and some innerwears, etc. as an inseparable component of our human body. An individual customized size is usually required. It often moves with the user ubiquitously without any apparent or obtrusive parts. Wearable device, it's an attachable device which is defined as monitoring modality that should be attached with human body is a non-invasive type, like it can be touched occasionally by a user intentionally. It is not a necessary item, but it's an unnoticeable impact on daily life, such as tattoo or pad or pedometer or mobile phone or tablet and other some portable devices. It usually is a one size for all. Actually, it's like a small kind of devices like a keychains or anything else. Even we can nowadays some non-invasive type wearable sensors are came that will be, it's like just a sticker part we can stick in anywhere that we can use with our day-to-day applications. How does wearable computer looks? So a typical wearable computer consists of a battery or a human powered computing unit and carried on a belt or in a jacket. So wearable computer will have a motherboard, it won't inside a fashion garment connecting all the components of the system. Wearable technology, it's an evolving into an important category of the Internet of Things with some life-changing applications like medicines or any other fields. It's also known as wearable. The growth of mobile networks with high-speed data transfer and miniaturized microprocessor, which have enabled the development of this technology. So these technologies may be worn embedded in fabric or accessories or tattooed directly onto the skin. So there are some type of wearable devices are there that later we will discuss. So now, what are the applications of wearable technologies in different industries? So that are sports and fitness, healthcare, entertainment, travel, education, retail, construction, logistics, and transportation. For many people, smart wearables have already become everyday companion, and the devices are very actively used both for personal and work-related purposes. So it has a lot of potential. Potentially, there is a huge market being still far from very saturation with steadily growing capacity in the coming years. So wearable technologies are improving and their popularity continues to grow. They open up great opportunities for device manufacturers, app developers, and companies doing their business in various industries. There is no doubt at all in the upcoming years, next another 10 years, the wearable devices will rule the entire world because of the humans' laziness day by day, it has been increased. The global markets of wearable in all about right or wrist or something. The wearable app development services is becoming increasingly demanded because of companies working in many industries find ways to use this technology to solve their business problems. Wearable devices, it create a new way of collecting valuable and accurate data about the user or customer's behavior, and we can use them to grow our businesses. That it is the basic argument while entrepreneurs should invest in this area. So the application areas are health and fitness, sports, entertainment and gaming, healthcare and medical, fashion, etc. I think some disturbances in the network. Please be muted. Please be muted. Yeah. So health and fitness, it's useful in just monitoring the fitness, calories intake, physiological monitoring, etc. It's like our watches, smart watches that we always own in our human body, in our wrist, and it capturing the data from the human body and it transmit to the some devices which are mobile phones, which will be accumulating the data and processing the data from the historical inferencing of data. It produces some decision model which is useful to take the decision about our health concern. Then sports, it's like just performance monitoring of the sportsman, body cooling and heating, and outdoor tracking, and the sportsman's navigations. Everything we can monitor through this wearable system. Like this type of wearable sensors we can fix with the sportsman, or a sensor like small kind of non-invasive sensors we can fix with the sportsman's shoes or their wrist or their clothes, innerwears, everywhere. We can fix and we can monitor the sportsman. And something called entertainment and gaming. It is a very fast-growing trend in nowadays. The entertainment and gaming, it's an interactive gaming and some virtual traveling, augmented reality, and some video streaming technologies. These things are very much useful for entertainment and gaming domain. Exclusively nowadays, wearable systems are very much useful to useful in the area of educational system. So using augmented reality and virtual reality and mixed reality, post-pandemic in the COVID-19 situations, nowadays it's very much useful to the students to create some lecture videos, and we can broadcasting the videos with the help of augmented reality and virtual reality and some mixed reality methods, that is called immersive learning techniques. Then healthcare and medical. So healthcare and medical, there is no doubt at all. Everywhere now we are using a small biomedical sensors. Like we can check our glucometer or for checking our diabetes. A small pin or something like we can press into our fingers and take the small blood drop, and we can fix into a small kind of sensor strip which is connected with our smartwatch or some smart devices. It's automatically it shows that our glucose level, how much it will be. Like similar kind of things, there are lot of small kind of non-invasive type of wearable sensors are now introduced. Moreover, in child monitoring, the premature babies monitoring, we can use this healthcare wearable system is very much an important key factor and key role to monitor the premature babies and all. Even nowadays, heart related issues or some human acute and chronic disease monitoring systems, we are using this wearable technology as a wearable smart sensor fixed with the human body, and the doctors and the medical practitioners are monitoring the patients in a remote manner. So there is inevitable role in this healthcare system as a wearable system. And next one is fashions. So intelligent clothing, eye-catching fashions with built-in technology for fitness and health monitoring. We use this wearable systems. So these are some wearable system devices, like which will be that is a conventional traditional computer to current wearable system, how it will be. See this is a wrist type of wearables. This is a touch type of wearables with along with the phone. This is the wrist another band type of wearables. This is smart shoes and even eye wearables, even our cloth wearables. Everything nowadays possible. So this is a nano based wearable system which can be fixed with the human body to monitor the peoples, like in the army applications or any other tracking applications we can use like this. So the technology roadmap. So technology roadmap here, see there are 4 phases of wearable development. Just anything or anyone or anytime or any place, any service, any network, we can use the wearable system. In the first phase of wearable, in the years of 2000 to 2017, the phase of first phase is accessory based wearables like smart watches, smart eyeglasses and all. In the phase 2, it's like a textile or fabric type of wearable. In the phase 3, it's a patchable. In the current years from the 2020 to 2000 present up to now, nowadays the developments are patchable wearable systems, like a small patch we can develop and we can fix with the human body whenever the body has touching that particular point. The device can be monitoring the physiological signals of the human body and it transforming to the cloud system or storage system or any other system like AI based or ML based system. They train the system and gather the information. The system will do that prescriptive descriptive analysis and making inferencing of the data and just provide some decision models to the system. And in the next advanced wearable system, it is an implantable wearable system. We can import or implanting the device into our human body, and now the advanced researches are going on with our human brain, how the brain signals will be transformed to our human body from the, how can we extract the brain signal, and what are the messages passed to the heart or passed to any other human organs, how it should be, like the kind of advanced researches are going on. So this some of the these implantable wearable systems are it's a low weight, self-sustained and conformal to other organs, and it's very safety to the human body. And this patchable system, it's a skin patchable devices like flexible or stretchable wearable sensor, and it's an ultra thin, it's a very ultra thin and some conformal to the skin. And the textile fabric wearables are, it's an integrated to the our textile like cloths or pants or shirts, something or innerwears integrated devices, which is very flexible and stretchable to the fabric, and integration of various electronics. Even nowadays we wear we own some headset or something like that. That is also a wearable, which is a wireless wearable like AirBots or something. So it will be integrated with the human body. It's a spill proof and waterproof, and something got some advancement in the wearable. And some accessory type of old wearable devices are very low power consumed wearable, and it's also conformal to the body. So types of recent wearable devices. That's what I said earlier. So wearable smart devices, it's an electronic device and components intended to be located near or on or in an organ of the human body that has intelligent functionality, or maybe a part of intelligent system via the connectivity, either wired connectivity or wireless connectivity. Next is near body electronics. So it is an electronic device which components are intended to be located near on an organism where it does not contact the external surface of the organism directly. The next one is on-body electronics. So on-body electronics, it's an electronic device and component intended to be located on an organism where it contacts the external surface of the organism directly. The next one is in-body electronics. So in-body electronics devices and components are intended to be located internal to an organism, and the electronic textiles, it's an fabrics or textile based electronic devices and components which is integrating with the human body. It's weird in the human body. Some of the examples of an on-body electronics, it is a searching system for people with cognitive impairment. So here the aim is to find patients in an early stage with a secure data management system. So the first one is a secure personal information system and registration of patients and quick information delivery of the lost patient, and some GPS and oscillators owned by the patient, and GPS in shoes because lost patients at least wear the shoes. So these all the informations can be integrated with some centralized data management system which will be maintained the databases. So these all working with the internet. So that's what we call a wearable system as one of the sub part of Internet of Things. So some design factors of wearable technology, which is some methodologies, it's a unique one to follow for design and develop a wearable system. First one is identify the necessity. So what are the necessity we have to develop the particular wearable device? So first of all, we have to identify the problem statement. Depending upon the problem statement, first identifying the task, what are the tasks involved to develop a wearable system, and identify the relativity of the wearable system. Wearable relativity with from the task and wearable, how the task should be working in a wearable component, how the task should be active to all the users of the particular problem statement. We can correlate with the task and correlate with the relativity of the task. The next one is modeling domain. So modeling, we can define the design criteria and define the wearable constraints and attributes, design the concept, and virtual and mathematical modeling. So how the device will be worked with the virtual environment. So what are the component has to be employed in the particular modeling, how the wearable, what are the constraints and attributes are there, how we can overcome the constraints. Because once we going to develop a wearable device, once we going to develop a wearable device, the device should be more worthful to all the users. So it will be satisfy the users with the 100% of effective utilization. That's what our wearable device, our device development should be an effective one. Unless it's very tough to achieve the utilization from the common layman mind. So whenever we are going to develop a new device or new development or new invention, our invention and device or development, whatever it may be, it should be useful to the common layman people who are having without education knowledge. So then only our system will be more effective. So all these concerns are taking care very carefully, and how our device model should be utilized and useful to the end level consumer. That's what our system development should be a more effective and it's a successful one. So all these things will be involved in the modeling phase. Then next, control and manufacture. So in the control and manufacture, there is the experimental physical model, which is a prototyping model, which is making all our experimental activities in the particular model. A detailed engineering design should be developed for the particular device, and a behavioral assessment should be happen, and numerical simulations will be happen, and finally we can make the control system and the control flow, how it will be synthesized from the one device, one module to another module. All the things will be integrated together. We manufacture the particular device. After the design and development of the device, then next phase is experimentation and assessment. In this phase, our experimental physical model will play a major role, and the model operational assessment will be analyzed and it produce some decision making report. Based on that, the device should be going to the market for the trial and error method, and once the trial application has been running to the market, we can receive lot of errors, and we can receive lot of communications from the end level consumers. They can give better suggestions to improve our quality aspect and another advancement or innovation model aspect. So those things can be evaluated, and it should be a normative and ethical implication should be followed in this experimentation and assessment module. So these are the design and development strategy of a wearable device. The next one is wearable system iterative design methodology. There are 4 phases are working out. One is phase 1, identify the necessity, and phase 2, modeling, phase 2, manufacturing and controlling, and if it is not satisfied, again it goes to the phase 2 as a modeling phase. Then finally experimentation and assessment will be happen. So all these phase 1, phase 2, phase 3, phase 4, it should be a design goal, which is called innovation, design and development. The next stages in wearable technology prototyping. There are 3 stages. One is feasibility one is prototype model. There are 3 prototype stages. One is feasibility prototype and form factor prototype. Sorry, there are two type of factors. One is the feasibility prototype and another one is form factor prototype. So feasibility prototype, there will most always be a very specific technical uncertainties remaining with the product proposition, and in these unknowns which form the focus of work on a feasibility prototype, which will be expanded on it the next post in the series. This prototype is very specific in that it is not a product prototype, but it's an aimed at understanding the specific key technology. For example, let us take an example, and embedding a specific sensor in a fabric cloud, which is represent the single biggest risk to your product proposition. And at this stage, we can ignore all the other factors, like develop this element in isolation and test it and very carefully. The next one is form factor. Form factor prototype, it's addressed that it confirms how the future product should look, feel, and be worn. This is also a set of targets for future and miniaturization of the electronics and battery, and the size and optimization. Now, one of the main goal of design development of the wearable system is battery usage, because the wearable device fully 24/7 maximum of the time the device has been owned by the human body or the people. So at that time battery consumption is very much important role. Once the battery is less, getting down, then we can't capture the device and we can capture the data from the human body, so that our entire target sets will be lost. So that battery consumption design is very much important factor here, and it makes all the commercial and user proposition much very clearer and engaging the stakeholders and the investors. So wearable sensor market. Next one is wearable sensor market estimate and forecast. According to the latest report of Polaris Market Research, the global wearable sensor market is growing at a faster pace, and it's projected to reach nearly 4,281 million US dollars in the year of 2026, as registering a significant CAGR of 37.4% during the forecast period of 2018 to 2026. Now, the global market report provides a comprehensive evaluation of the market for the forecast period, which comprises of analysis, analysis of the industry in terms of factors and trends that are playing a vital role in the overall progress of the market. So this report provides a key analysis of the current dynamics, major segments, competitive landscape, major innovations after COVID-19, the pandemic impact, and other factors that are playing a crucial role of the market. Even though this kind of things, the huge investment in the R&D activities also going on, the presence of leading global players, significant progress in terms of technological advancements and supportive government policies, and creating a positive outlook for the overall growth on the wearable sensor market. So the next one is some wearable sensors on the scope by type, by technology, by application, by end user, and by region. So some of that are motion sensors, which is using a MEMS technology, and mainly in the smartwatch applications. The end user is consumer, and it started from the yeah.
Sir, it's not
Hello?
audible, sir. Yes, sir. Yes, sir. It's audible, sir. Now it's audible.
Yeah, sorry for that. Some technical issue in the internet. My internet.
Okay, sir. Okay, sir. No,
Yeah,
no problem, sir. No problem at all.
Yeah, I'm sharing again. Yeah. So my screen is visible?
Visible, sir. It's visible.
Yeah, thank you. So now the wearable sensors. The next one is gyroscopes, accelerometers, pressures, some force sensors, touch sensors, inertial sensors, and some magnetometers. And by applications are smartwatches, smart fabrics, gyroscopes are measured in the smart fabrics, and accelerometers are measured in the smart glasses, and all pressure sensors, force sensors, touch sensors. These are the things are measured in the fitness band and smart footwears and others, etc. So the next one is some practical applications of AI and machine learning, which is related to wearable computing. So the first one is, before going to this, we have to see something, some key points. Wearables and the Internet of Things. IoT may give the impression that it should IoT may give the impression that is it's all about the sensors, hardware, communications, middleware, network, and data. But the real value of the IoT is in the insight of utilization, 100% effective utilization of the devices. So what's reality? The strong artificial intelligence versus weak artificial intelligence. Before running for the hills, let us pause for a reality check. It's an important that we don't confuse artificial general intelligence with the subcomponents of artificial intelligence applications. Artificial general intelligence or a strong artificial intelligence, which is defined as intelligence of a machine that could be successfully perform any intellectual task that a human being can. For a practical wearables and IoT implementations, we are very working with the weak artificial intelligence. Why? Because the studies as a specific program or a specific problem solving or a reasoning task and does not attempt to simulate the full range of human cognitive abilities. There are AI applications that exhibit capabilities such as visual perception, speech recognition, and decision making, but none at human level. So the jam from the stitching subsystem bottom up to fully intelligent machines in the galaxy is wide. So some of the practical applications of AI and machine learning, which is related to the wearable systems, are example from Apple's Siri, Google's voice search, Google Brain, Google Translate, Xbox, Netflix, Watson, IBM's Watson, and autonomous cars like and now Elon Musk, Tesla, they have an email spam filtering to credit card fraud detection. So many. In AI has already infiltrated into nearly aspect of our daily lives, and our depends on it's only growing. So how can AI and machine learning be applied to wearables and the Internet of Things? Let's walk through some few examples. Medical diagnosis treatment. Lumiata. So Lumiata is a company. Lumiata's machine graph is based on the multi-dimensional probability distribution and the contents of 160 million data points from the textbook, journal articles, and public data sets to replicate and scale doctors' knowledge for use by nurses to diagnose and treat illness. And add a patient-specific data, effects on time and location to Lumiata massive data set. The machine learning system is able to generate a clinical model of patient. In the future, clinically approved wearables can interface with the Lumiata's API to provide a constant feed of a patient's psychological and physiological data, time and place for proactive monitoring and even triggers. So nowadays, it should be a proactive. That's what in the fast growing world, we don't have the time to see everything. We don't have the time to listen everything. So in a proactive manner, everything, it's like a wearable bot or a robot, which will monitor very closely to all our day-to-day activities, and it should be taking a proactive decision to save us. That's what we are nowadays going with this wearable system. Now, preventive health. Another example is preventive health. It's a Google X nanoparticles. So Google X recently announced that they are researching the use of nanoparticles released into a bloodstream via swallowed pill, or nanoparticles can proactively detect and diagnose the diseases like cancers and impending heart attack or strokes based on the changes to the person's biochemistry and physiological signal process in their day-to-day physiological activity at the molecular and cellular level. It's a very innovative research, and the patient can then use a wearable wristband to view readings of nanoparticles. Google aims to use some nanoparticles to clump around a cancerous cell or identify the fatty plaques into the lining of blood vessels, and thin and thick process of blood vessels about to break free and potentially causing a heart attack or stroke. So machine learning can be applied to learn to diagnose the diseases and changes in biochemistry in the bloodstream through the movement of nanoparticles. As unattached nanoparticle would move differently in a magnetic field from the clumped around, for instance, in a cancer cell. So the next example I want to say to you, the preventive health entopsis. So another early molecule diagnosis startup is called Entopsis. It's a medical diagnosis platform that can screen the medical conditions using a nano engineering and machine learning approaches. So Entopsis is able to detect the patterns and biomarkers that point to specific conditions by analyzing the protein composition of the biofluids. After incubating a biofluid sample using their nanoscale unbiased textured capture technique to capture the molecules, Entopsis applies its signature analysis based on the machine learning algorithm to analyze the molecular signature on the same nanoscale unbiased texture capture glass, and the scanned signatures are then uploaded to the cloud to run signature comparison against other in the database to find the similar profile. So it's like a historical data analysis. So it matches with the historical data and inference the data and produce some report to take the decision of the particular consumer or user. The next one is body movements. Body movements, it's an Atlas wearable. So Atlas wearable is very much known about us. So Atlas wearable is a fitness band plus intelligence platform powered by the Motion Genome Project database of movements. Aside from measuring the heart rate and calculating the calories burned, so Atlas climb to fame is their machine learning algorithm that automatically classifies your exercise routine in the 3D vector, it being able to decipher the difference between push-up and triangle push-ups. So the exercise detections is just the beginning. In speaking with co-founder Peter Lee in the last month, I went to their laboratory in Bangkok. The startup aspiration is to bring intelligence into the body language and movements. So machine learning algorithm and data sets can be extended to understand how we are walking, how we are sitting, how we are moving, or how we are interacting with others. So that can give a clues about your mood, your physical reactions, and your energy level, and even context. So apart from this, so many activities nowadays with machine learning along with areas like affective computing with the company called Affectiva. Bioinformatics is classifying biological sequences, clustering and biological entities. Brain machine interfaces, which is used in the emotive. Brain neurons connections in the eye wire. It's a crowd source. And cheminformatics, which is Thomson Reuters system biology, and classifying DNA.
Sorry, sir. Actually, your voice is not audible, sir. Sir, it's not audible, sir. Sir, it's not audible, sir. Dr. S. Jafar Ali Ibrahim, sir. It's not audible, sir.
There is no voice, sir.
Sir, it's not audible, sir.
No audio.
Jafar sir, are you there, sir? Jafar sir? Participants don't move anywhere. There will be a network issue from the Jaffa sir end. Please be connected. Maybe sir will be reconnect within few minutes. Please be connected. Dr. Jafar sir? All the participants present over here, please wait for a few minutes. So sir will be reconnected within a few minutes. Please.
Madam, are you able to hear me? Hello?
Yes, sir.
Hello? Are you able to
Yes,
hear
yes,
me?
you are able, we are able to, sir. Please continue now.
We are able,
Yeah,
sir.
yeah.
We are able, sir.
Yeah. Sorry for that. I'm some little bit my internet connection is unstable. Okay, I'll share the screen. I'm coming to the conclusion almost.
Okay, sir. Thank you, sir.
So some of the unbody, I think some of the examples I said. So in the inputted facts of variables like IBM options, some medical diagnosis like entopsis, Google X nanoparticles, some natural language processing with the variables like Google Translate, IBM Watson, Fluid, ND Byline, Welltalk, some Helpline, Elan. So these are the global companies, and some protein prediction analysis research like Nobel Research Laboratories, some recommender systems with the help of variables like Amazon, Netflix, some robotic locomotions like Honda, Zemo, and some sentimental analysis like Twitter, Google Prediction API, Alchem API, Beyond Verbal, some speech recognition and handwriting recognition through like Google Translate, and some text categorization like Gmail, Outlook, etc. So these are all the things. These are all the things are some important practical applications of AI and machine learning, which is integrated with wearable systems. The next one is IoT in smart healthcare. So some of the few examples I gave here for how the wearables will be. So IoT enabled a sensor system which can monitor the physiological and clinical parameters promising with the smart healthcare. So it's like a smart watch or a smart band or patch type of sensor which will be worn in our human wrist or human neck or some anywhere human backside are implanted with our neck or something. So it will be gathering the data from the human body and transform to the devices which will be related to which will be connected to in internet and cloud based environment. with the help of some smart network. It provides some preventive medicines and diagnostics and prognostics and rehabilitation therapies. So some of the IoT-enabled sensor system for smart healthcare like standalone sensors, smartphone integrated sensors, some addressable sensors, accessory sensors, skin attachable sensors, and implantable sensors. Some of the mobile point of care testing devices are like ISTET from Abbott Laboratories, blood analyzer from Aller, QCheck from Roche, some crop check from Roche Network, some status profile analyzer from Siemens. Some of the impact advantages are advantage in connectivity like spatial temporal mapping, epidemic demography, preventive healthcare, but limit of some low accuracy and low standardization. But and another one important role is the battery consumption. So accessory type is a non-invasive, but why we go with the skin attachable sensor practice in wearable? Because of the accessory type, like non-invasive but limit in unobtrusive monitoring, and the patch is a non-invasive and unobtrusive monitoring, high SNR due to signals to noise ratio due to conformal contact with the skin, and it's a very easy of appreciation with the human environment. So with the help of this wearable skin attachable sensor patches, we can monitoring all the parameters of human body like ECG, EMG, EEG, whatever skin temperatures, elasticity, strains, galvanic response of the human being, and newborn babies, etc. And the activities like all the activities of the human body, everything we can monitor with this kind of skin attachable wearable sensor patches. So perspective. So efforts toward the improvement of stability and reliability of the sensing of nanomaterials and required for real applications, the sensor integrated systems by combining microcontroller unit and communication components, energy and sample handling devices. It need to be developed by considering some specific service needs. And collaborative research in these essentials are going on for the successful device development. So thank you for the opportunity for me to give a keynote delivery in your a wonderful 5 days online FDP for FDP on this machine learning techniques. Thank you for the management given to the opportunity to me. I'm once again thank to the management principals, head of the Department of Computer Science and Engineering, and faculty coordinators and the professors and the students from the Sri Vishnu College of Engineering. And thank you, Anand. Thank you. Any doubts, please let me know. I will clear your doubts. Audience, is there any doubt? If you want to interact with anything else, please let me know.
Hi, sir. This is a wonderful session.
Thank you, madam.
Myself, Ramya. If you, for example, the activity tracker by using the mental illness people, how it is useful for those people, sir? Can you say some example?
Yeah, exactly. I tell you some examples. So for mental, for activity tracker for the this mentally challenged people, just without any other person's help, the people can be fell down in any place, or the people can be move from one place to another place to pick something or put something. That is very difficult without any assistance. So that time we can pick some wearable device. Wearable devices. Hello. Yes, somewhat disturbances. Yeah.
Continue, sir, please.
Yeah. So that kind of devices, that kind of situation from the mentally able or mentally challenged people, we can pick some wearable devices like a gyroscope or some galvanic skin response sensors, which can be predict the people's what they want to exactly to do, depending upon their mood, behavior, and their physiological signal challenges from their human body. The device can be make predictions, and it can give an alert to the caretakers that people want to do this want to walk here, want to take that particular product from that table or something. It can give some messages. So something like it will be very useful to the mentally able to peoples, madam. I hope I answer your query, resolve your queries.
Yes, sir. But how we can give some alert to the caretaker or something, doctor?
Yeah, that we can make an integration between the one cloud-based environment which can gather the signal. Then from that cloud too, you can integrate with some mobile network using some GSM modules. You can connect that. You can integrate the system with wearable and cloud environment and consumer or application interfaces. Like with the help of some GSM module, we can establish the connection between all these three integrated together and provide some alerts to the caretaker or end user or whomever, like medical practitioner, somebody.
Thank you so much, sir.
Thank you, madam. Thank you. Pleasure.
Anybody else for the queries? Thank you so much, sir. Dr. S.
Thank you,
Jafar
madam.
Ali, sir. Thank you so much for
Thank you.
your
Thank you.
immense presentation on the topic recent advancements in wearables. We came to know that important red points on wearables and which way we can use in an innovative way in the medical field.
Yes, madam. Yeah. Thank you and pleasure. Thanks, Manandal. Thank you very much.
Thank you, Dr. Jafar. It's a privilege to see you online.
Yeah. Thank you, Professor. Thank you.
Thank you very
so
much, sir. Have a
Let
nice
us
day.
work together in coming days. If anybody interested to do some research activities with wearable, please let me know and write an email to me. Here I am doing a very close research activity with the help of premature babies monitoring, as well as from the babies are in the fetus itself, from their fetus growing stage itself. I am now just analyzing their all the physiological movements and all with the help of some wearables. That could be a good in future. It will be a good research for the community and societal
So you are
development.
into IoT now, purely into
Yeah.
IoT, something like that. Yes.
Yeah, IoT wearable is one part of IoT.
Thank you, sir. Have a nice day.
Thank you, Professor. Have a nice day.
Thank you so much, sir.
Thank you.
Thank you so much. All the participants, please stay connected. The next session